Welcome to Healing Horizons. I'm Chris Daniels, your host, and today we're exploring why a growing number of veterans are choosing medically supervised Ibogaine therapy in Mexico over conventional PTSD treatment. If you're new here, this show blends science, lived experience, and practical guidance to help you evaluate emerging options with a clear, critical lens. Ibogaine is not a cure-all, and it carries serious risks, but many veterans report profound shifts when other paths have stalled. My goal is to explain the landscape, the science we have and don't have, the safety essentials, and how this approach can responsibly fit into a veteran's recovery plan. For context, PTSD affects a sizable minority of post-9/11 service members. Rates vary by era and exposure, but studies often cite double-digit prevalence, with many experiencing co-occurring depression, chronic pain, traumatic brain injury, and substance use. Standard treatments help many people, yet a significant subset remains treatment-resistant, cycling through medications, prolonged wait lists, and short therapy windows that do not match the depth or moral complexity of combat trauma. Common frustrations include persistent hypervigilance, nightmares, irritability, numbing, and isolation, alongside medication side effects and incomplete relief. When hope fades, some veterans look beyond the toolbox they've already tried, searching for approaches that address root causes, restore meaning, and reconnect them with purpose. So what is Ibogaine? It's a psychoactive alkaloid derived from Tabernanthe iboga, a shrub used in West Central African spiritual and healing traditions, especially within Bwiti practices. In modern clinics, Ibogaine is administered in controlled, medically supervised settings, usually as a single high-intensity session with careful screening and monitoring. Veterans are drawn to it for several reasons. Reports of rapid reductions in withdrawal and cravings when substance use is present, meaningful insights that reframe traumatic memories, and a felt sense of reset that can loosen rigid patterns of fear, shame, and despair. The experience is demanding, sometimes exhausting, and not for everyone, but it can catalyze significant shifts. Mechanistically, Ibogaine is complex. After ingestion, the body converts part of it into norbogaine, which hangs around longer and may support mood and impulse regulation. Both compounds interact with multiple systems. They influence serotonin and dopamine signaling, modulate NMDA and sigma receptors, and appear to increase neurotrophic factors that support neuroplasticity. Clinically, people describe a dreamlike introspective state in which memories surface and are re-examined, potentially disrupting rigid fear circuits and allowing memory reconsolidation from a safer vantage point. For addiction, Ibogaine may interrupt withdrawal and blunt compulsive drive short-term, while norbogaine supports longer stabilization. These hypotheses are promising, but we still lack definitive controlled evidence clarifying precise mechanisms and durability. What does the evidence say? We have observational studies, case reports, and small cohorts suggesting benefits for opioid and stimulant use disorders, depressive symptoms, and trauma-related distress. Some veterans report rapid reductions in nightmares and hyperarousal, along with improved mood and purpose. However, the data are not yet the gold standard. Randomized controlled trials are sparse, outcomes often rely on self-report, and samples can be biased toward motivated participants at specialized clinics. Importantly, adverse events are also documented, especially cardiac complications in unscreened or improperly monitored settings. The bottom line, early signals are encouraging, but high-quality trials are needed to establish safety, efficacy, and best practice guidelines. Why Mexico? In the United States, Ibogaine is not available for clinical use. Mexico, by contrast, permits its use in private medical settings, and over the past decade, several clinics have developed protocols focused on safety and integration. This legal landscape has created access for veterans who have exhausted options at home. The best Mexican programs operate like small specialty hospitals, physician-led teams, cardiac monitoring, emergency plans, and structured aftercare. That said, standards vary. Regulation is evolving, not uniform, and quality can differ widely between facilities. Choosing a program with strong medical credentials, transparent reporting, and veteran-specific support is essential to reduce risk and maximize the chance of meaningful benefit. Who might be a candidate? Many veteran clients present with PTSD combined with depression, alcohol or opioid use, sleep disturbance, and sometimes mild to moderate traumatic brain injury. Some are on disability or retired. Others are working but cycling through flare-ups. Contraindications are critical. Known heart disease, a prolonged QT interval, uncontrolled hypertension, certain liver conditions, active psychosis or bipolar mania, and recent strokes typically exclude participation. Dangerous drug interactions can occur, especially with medications that also prolong QT or affect metabolism. A responsible program requires complete medical history, medication review, lab work, and cardiology screening, and will coordinate with your existing clinicians to consider safer alternatives if risks are high. Safety is non-negotiable. Ibogaine can lengthen the heart's QT interval, increasing risk of arrhythmias. Doses are managed by physicians, but the real protection comes from systems: pre-treatment EKGs and labs, continuous cardiac and pulse ox monitoring during dosing, IV access, electrolyte management, and on-site advanced cardiac life support capacity. Clear medication tapers or holds must be supervised by qualified prescribers. Abrupt changes can be dangerous. Facilities should maintain transfer agreements with nearby hospitals and drill emergency protocols. After dosing, observation continues as Ibogaine persists. If a program minimizes these risks, rushes intake, or cannot explain its safeguards in plain language, that is a red flag to walk away. How does this compare with conventional care? Many therapies, such as trauma-focused CBT, EMDR, and medications, work gradually across weeks or months. Ibogaine, by contrast, concentrates the intervention into a brief window that can produce rapid subjective change. Side effects differ. Standard meds may cause weight gain, sexual dysfunction, or sedation. Ibogaine carries acute cardiovascular risk and an intense, often challenging psychological journey. Durability varies. Some veterans report meaningful improvement for months, especially with strong aftercare, while others need additional therapy or relapse prevention soon after. In practice, Ibogaine can be an adjunct when progress is stalled, or an alternative pathway when conventional approaches have not provided relief. Across veteran stories, certain themes recur. Many describe moral injury, deep conflicts between personal values and wartime actions, paired with grief and survivor's guilt. During the Ibogaine experience, they often revisit pivotal memories with an expanded perspective, sometimes encountering powerful symbolic material that reframes blame and restores compassion for the self. Practical outcomes include reduced hypervigilance, fewer nightmares, and an increased capacity to be present with family. For those with substance use, decreases in cravings can create a critical window to commit to sobriety supports. Most importantly, a renewed sense of purpose emerges, not forgetting the past, but integrating it, fueling service, mentorship, and healthier leadership within veteran communities. Preparation matters. Informed consent should be robust, covering benefits, alternatives, and risks in detail. Clear goals help guide the experience, reducing nightmares, healing a specific wound, or resetting from addictive cycles. Veterans often benefit from writing intentions and gathering letters of support from trusted peers or family. Practical steps include arranging time off, stabilizing sleep, nutrition, and hydration, and clarifying who will provide post-treatment support. It's equally important to name fears, loss of control, painful memories, disappointment, so the care team can plan grounding strategies. A good program will screen expectations, not promise miracles, and emphasize that the real work begins after the medicine session. Integration translates insight into daily life. Pair the experience with ongoing therapy, EMDR, or somatic approaches for trauma processing, CBT for skills and structure, and couples or family work to repair trust. Many clinics offer veteran peer groups, virtual check-ins, and referrals to VA-compatible providers. Movement, breath work, sleep hygiene, and low-dose light exposure in the morning can steady circadian rhythm and mood. For substance use, Add recovery supports and contingency planning for triggers. Track changes for 12 weeks, since Norbogaine's tail may influence mood and energy. The objective is not to chase another session, but to consolidate gains with consistent practices and a reliable support network. How do you choose a reputable clinic? Look for medical leadership with verifiable credentials in emergency medicine, cardiology, anesthesiology, or psychiatry. 24/7 physician presence during dosing. Continuous EKG pulse ox and blood pressure monitoring. Crash cart and defibrillator on site. And written emergency pathways. Ask about exclusion criteria, medication management, and average length of stay. Seek transparent, de-identified outcomes and complication rates, plus robust integration support. Watch for red flags, pressure sales tactics, miracle cure language, casual attitudes toward heart risk, or recommendations for frequent repeat dosing. Speak with alumni, ideally veterans, and confirm that your support system and therapists can coordinate care before and after treatment. Practicalities. Programs range from several thousand to 5 figures, plus travel. Nonprofits subsidize veteran care. Plan a week or more away from work and family, with recovery days on return. Ethically and legally, make informed decisions, protect privacy, and clarify documentation needs. Active duty service members should review policies with counsel, while veterans may share selectively with clinicians. Myths to avoid. Ibogaine is not a quick fix, and repeating doses too soon can increase risk without added benefit. Resources. Review literature, veteran advocacy groups, and consult your healthcare team. In closing, we covered science, safety, stories, and next steps. I'm Chris Daniels. Thanks for listening to Healing Horizons.